Hello friends, I'm Dr.V.Pradeep. I'm a psychiatrist. I'll be talking briefly about anxiety disorders. What are anxiety disorders? They have both psychological symptoms or physical symptoms or both. Psychological symptoms are patient will be very stressed out, emotionally drained, scared, worried, frightened, panicky and irritable. Physical symptoms are tremors, restlessness, disturbed sleep, palpitations, headaches and chest tightness. Coming to the types of anxiety disorders, the first is generalized anxiety disorder. In this generalized anxiety disorder, there is excessive and unrealistic worry that is disproportionate to the situation and interferes with the routine day-to-day functioning. Panic disorder, feelings of terror that attack suddenly and can occur with sweating, chest pain, irregular heartbeats and a feeling of choking. The person may believe is having a heart attack or going crazy. The quality of life can be affected because the person is in constant fear of another attack. Obsessive compulsive disorder. This is an anxiety disorder with unreasonable and unwanted fear that causes repetitive behaviors and obsessive thoughts and rituals. For example, a person with an unreasonable fear of germs will obsessively wash their hands. Other example includes counting objects, checking, and irrational fear of doing something wrong. Post-traumatic stress disorder can be triggered by a traumatic event such as a war, accidents or natural disasters that leave people with lasting and frightening flashbacks, nightmares and uncontrollable thoughts about the experience. Social anxiety disorders. In this, there is overwhelming worry and self-consciousness about day-to-day social situation that can often result in isolation and avoidance of the social situation. In this, the worry centers on fear of being judged by others or behaving in an embarrassing way that can often lead to ridicule. A specific phobia is an intense fear of a specific object or a situation such as heights, flying, or really afraid on seeing blood, needles, etc. The level of fear is usually disproportionate to the situation and may cause the person to avoid common everyday situations.